As UP reels under dengue outbreak, Mirror now has accessed recommendations made by the central team to the UP government. The recommendations include screen all fever patients, strengthen testing facilities, strengthen surveillance, add more isolation beds and augment admission facilities. So these are the recommendations made by the National Disease Control Team that is currently in Uttar Pradesh, trying to help the state authorities handle the situation. Remember, there's been a major dengue outbreak which has caused deaths, and the epicenter being Firozabad, where there have been issues with handling the spread of this epidemic. Of course, other districts, as many as 11 districts in all in central and western UP, affected by this outbreak. Ayushman joining us live from Mathura. So this is another district where 12 deaths being reported. Ayushman, 258 dengue cases so far, 12 deaths in Mathura as well. What do the authorities tell us about how they are handling the situation in Mathura?
Well, Afrida, right now I'm in the district hospital of Mathura, where this is the emergency ward, where we are being currently told that situation looks better than what it was in Firozabad. We've also gone to see the situation in Vrindavan as well, because there also the cases are being reported, and both these places, be it Vrindavan and Mathura, the situation looks bit better than what we saw in Firozabad, but the cases are coming, and it is not just the outer periphery of the city. The villages outside, in the outskirts of Mathura and near to the border of Agra, a few of the villages are there where the deaths have been reported, and also a large number of cases are coming from there. We have been currently told that the district team is already there. We'll be going to those villages also to see what is happening on ground, because what we have seen so far, Afrida, is that the queues which we were seeing for blood reports and blood sampling in Firozabad, that is fortunately is not present in Mathura as well as Vrindavan. But the case coming from a single village, that is also being reported from this area. Currently, we have been told that 12 deaths have taken place so far in Mathura region, is what we are being told. But the situation on ground is completely a bit normal than what we saw in Firozabad. Afrida.
Yes, you know, it's not just Firozabad and Mathura, Ayushman. We are given to understand other districts are similarly now affected. Can you tell us what exactly has the NCDC team now observed? Because the central team is also assisting the health authorities in Uttar Pradesh.
When we started, Afrida, if you remember, it was a mystery fever. So what has been recommended at first is that you need to have, all the patients need to be screened for dengue, malaria, scrub typhus and leptospirosis. These are the 4 probable reasons and the diseases which are being identified in Uttar Pradesh. In fact, in Firozabad, we were told that leptospirosis and scrub typhus and also dengue are the 3 most reported diseases there. Apart from that, the entomological activities to be strengthened, and the short reorientation camp, because a lot of patients are there from the village area. So the primary health care and the secondary, the CHCs and district hospitals need to be aware of what medicine has to be given. That is what has been said, and it has been also said that surveillance has to be strengthened. We also met an NCDC official yesterday in Firozabad, and today also the nodal officer said that there has been teams which have been camped, and they have been debriefed about it. They have been told what has to be done on ground level, because once you start the intervention, it is only after 2 weeks you see the number of cases getting stabilized or the number of cases getting decreased. In Western UP and also in Central UP, what is happening currently is that the numbers are on rise, is what we are currently being told. It is only in 2 weeks after all those vector-borne diseases intervention will be done, those cleaning will take place and all the other activities will be done. Only then you are going to see next 2 weeks the effect to be there on ground, and that is something that the NCDC team has suggested. Also, there is one team which will be camping for next 14 days to look into the situation as to how the situation evolves. For now, they have made some recommendations on which the government of Uttar Pradesh and the health department has to focus upon.
Absolutely. This is going to be challenging, but then, of course, this is the duty of the authorities to immediately ensure that more people are not affected by this epidemic and enough and more measures are taken to arrest the spread. Thanks for joining us, Aishma.